the last thing you want to do is to automate a bad process. There's all these exciting new toys, there's all these exciting new technologies, but it's really about fix the boring bits first to then be able to implement these kind of technology. For us, the patient doesn't trust in digital solutions. The patient trusts in the fact that we are going to deliver their care and medication to them.
In healthcare, trust isn't optional. It's the foundation of every interaction, and the cost of getting it wrong is high. But in digital environment, trust doesn't come from handshake and white coats. It comes from clarity, consistency, and care by design. So, Jean-Noël, how do you ensure patient trust is built from day one, especially when care moves from face-to-face to screen-to-screen?
Thanks, Stefan. That's actually quite an interesting question. So I would say that trust actually it starts beyond digital, right? So we have our approach here at Axios that we call digital first, but not digital only. Basically, what that means is that we push digital solutions to patients or stakeholders that can actually use them or that have the capacity to use them. Because so we work mostly in low to middle income countries. So, for example, some patients have a hard time accessing internet, a hard time accessing a smartphone, or sometimes they have a smartphone that can't charge it. So it's important for us, right, to be able to provide our care, even without the digital solutions if needed. But where possible, we do push digital solutions because they normally yield better outcomes. So I would say that's the first part of it, because for us, the patient doesn't trust in digital solutions. The patient trusts in the fact that we are going to deliver their care and medication to them, right? And in a way that is, I would say, aligned with their situation and with their means. The second thing, and this is also goes back into the digital first but not only approach, is that while we really leverage digital solutions, we also have teams on the ground that call patients, that they proactively reach out to patients, either daily, weekly, depending on the needs of the disease area. And this is really how you build trust. I think this human touch is really where trust is getting built. I think digital solutions are amazing. I work in digital for a reason because I do believe in it. But at the same time, I also think that we cannot lose this human element to interactions, and that digital is an enabler. And this is where our teams really help with that. The second thing I would say, and this is also, I think we've reached, I would say, a fairly high level of trust, both with our clients and partners, but also with our patients. Patients mostly because whenever we design something, when we designed our patient app, we included patients very early in the design phase. So it wasn't us just designing a solution for them. It was us designing a solution with them, right? And we also, I would say, kept a continuous feedback loop to make sure that any feedback that they may have, positive or negative, that not only we receive, but we also respond to, because they need to understand that they're being heard, right? And this is also something that's quite, I would say, relevant to healthcare, is that you also build trust by building a good patient experience. And in healthcare, the patient experience is sometimes not always tied only to the patient. And this is why, so we have a digital ecosystem, right, that we build. We have mobile applications for physicians, mobile for pharmacists, patients, and then we have a lot of different digital solutions for different stakeholders. And what we realized is that because we're saving the physician a lot of time on paperwork because everything is done digitally, so a process that would take him half an hour and it takes him 2 minutes, because the dispensing process for the pharmacist that used to take him 20 minutes now takes him 5. Well, we realized that because we heighten the experience of these stakeholders, then in turn, they have more time to spend with the patients, and it increases the overall patient experience throughout the program, right? So all in all, trust, I think it's about making sure that there's a human contact element, making sure that you, I would say, include, for us as patients, but any stakeholders really early in the design, and make sure that you get feedback and act on that feedback. And the third is see how you can shape, I would say, and interact with the environment around the patients to increase their experience, which will then lead in trust.
Thank you very much for this very clear answer, Jean-Noël. So now one thing is, most companies in this space are buying, or maybe they are licensing, they outsource this digital ecosystem. So, but you didn't. You build your own ecosystem. That's just not a product decision. This is a leadership decision. So what convinced your leadership team to invest in building rather than buying this ecosystem?
That's a good one. Okay, I mean, frankly, the first thing is that we just didn't have a choice. And I'll tell you why. So, first of all, so we work in access to healthcare, right? So it's quite a specialized market. It's quite a niche market. There's not a lot of people in this space. There's not a lot of companies in this space. And there sure as hell isn't a lot of digital, I would say, providers in that space. So at first, when we decided to really push digital, right, we were looking at digital solutions that we could buy off the shelf. And what we realized is that there were none that would fit our needs. And that even if we got an external provider, we would have to spend an enormous amount of time and an enormous amount of money to customize the solution that they would provide. So we figured, might as well build our own. So again, there's another very core element to that, is that we were, and we still are, the leaders in this space, right? And we nearly created the access space as well. And our processes and the way we interact with patients, the way we manage programs is one of our greatest strengths, and it's one of our greatest assets, right? And what better way to capitalize on that asset than to create a digital ecosystem that recreates these processes, right? But in a digital manner, to make sure that we not only improve the operational efficiency, I would say, but also improve the patient experience down the line. So that was the pitch. Now, how do you convince the full room of people that you want to invest, a couple $1 million of creating a digital solution? The first thing for us was capitalizing really on timing and momentum. It was around 2017, 2018. This was the time where everybody was pushing digital, or clients were pushing digital. All healthcare, I would say, involved enterprises and companies were pushing digital. This is where you had also the FAGA pushing digital. This is where, it was the rise of Apple Health. Amazon was also looking into Alexa for health uses. So it was a whole time where everybody was pushing for digital. So it was clear to everyone that it wasn't a question of how, like, when we would get the digital solution or digital ecosystem, but how, and because the time was now, right? So you still need to explain how you're going to spend millions of dollars on this thing, right? And for us, it was actually quite simple, because it was really about tying digital investment to tangible value, right? And for us, there was two aspects, right? One, we clearly communicating that it wasn't just about patients and clients. Obviously, digital would bring a lot of value to patients and to and for overall patient outcomes, right? But on the other hand, what we realized is that if we put this thing together, it would also be a major step, towards improving internal, I would say, operational efficiency. So it was about, not only do you increase patient outcomes, right, but at the same time, you reduce your costs, or, at best, you are able to support more patients. And this is actually something that one of my old mentors told me, and I've been using this ever since. In these kind of presentations, in these kind of decision-making moments, don't present judgment, present data. And that's exactly what we did. We did projections on, how many patients each of our patient managers would be able to handle. We made projections about the time it would reduce in the process for patients to actually get their treatment. And we actually reduced the time it takes for a patient to come into the program and then get their first treatment by 50%, right? So it's really about present the data, obviously steer the data towards whatever outcome you want out of the meeting, but let the decision makers make their judgment based on it, right? And the third thing, how we created buying, and I think that this is something that really, really resonated in the board's mind, was that, so we operate in 45 countries, 40 plus, right? Across all continents. You have people from a dozen different nationalities, a dozen different cultures. We have patients all around the globe. And on top of that, we also have, I would say, varying levels of digital maturity and digital acceptance across the business. So one of the key things as well is that we had a real plan for change management. So we involved teams early across all programs from the beginning, and we wanted to really build a sense of ownership to ensure that the system really reflected the end user needs. And we did this before coming to the meeting. So it wasn't just about saying, oh, we have a plan to do this. It's like, we've actually talked with 15 teams. This is what they told us. And this is what, we took, the insight we took to actually mold the plan to have I would say, take this digital ecosystem off the ground.
Of course. And I have a specific question on change management, because you mentioned that you need to deploy your solution in different countries with different, I would say, adoption of technology for different patients. So when you build your global digital ecosystem, what were the main change management challenges across all of those countries, and how did you overcome all of them?
Well, there was actually quite a lot. But I'll focus on, I would say, probably on three key ones, right? The thing is that, again, we worked in 40 plus countries. And obviously, because you work in healthcare, you're depending on the healthcare environment on these different countries. They have their different infrastructures, different healthcare systems, different, same thing, different levels of digital integration in these systems, right? And they have different workflows. Patients don't go through the same journeys, whether you're here in Paris or in Dubai or in Thailand, right? The journey of the patient is going to be different. And what we realize is that, well, we have workflows that are different across all these countries. So we need to harmonize them and bring them into, I would say, one key workflow and streamline process across all region, which obviously was quite a challenge, right? Because we also faced resistance from the teams because they were, I would say, reluctant to give up local autonomy, right? And to adjust to these new global processes. But again, this is why including them in the decision was a key factor, because this is where they realize we're not doing this to you, we're doing this for you, and you need to help us, push this. The second, I would say, key challenge for change management was everybody has different expectations when it comes to digitalization. Like some see it as an enabler, that's a great thing, probably like you and I. And other, I would say, are a bit more skeptical, right? It's like, oh, I'm going to have to change the way I work. And this is something we actually see a lot when we externally more than internally now. But even if you look at physicians, doctors, they are known to be quite resistant to change because they have been operating in a certain way for a certain number of years. And, there's a real resistance to change there. So for us, it was really about how can we align these expectations across the business, right? And also, even on the client side of things, some clients had a great appetite to have a digital solutions. Other, had varying levels again of digital maturity. So they didn't really want for the operations to go digital, right? So that was the second, I would say, the main challenge was really the misaligned expectations. And the third one is scaling it. Scaling is complex. And same thing for us. Like there was, as I mentioned, you need to navigate a lot of different environments, but that also means different regulatory frameworks, different organizational structures across countries, right? And this is where the one size fits all really doesn't really work. So the approach that we took is actually, we had, okay, let's do the main trunk that does 80% of the process, and then we can have add-ons for different countries, right? So it's really about streamlining process was the main challenge, misaligned expectations, and then scaling, right? And how we solve them, as I mentioned, is really quite simple. It's really hard to do, but it's quite simple to say.
As always.
As always, but it's really open communication and transparency.
Yep.
So as I mentioned, bring the teams early, make sure that you're very clear about what you're trying to do, no hidden agenda, just make it fully transparent and make it in a way that they can check on progress, right? And when you speak to them, and obviously this is applicable internally and externally, but it's like tailor your speech to the person you're talking to, right? If I'm a physician, I want to understand how this is going to impact me. If I'm a member of the compliance team, I want to understand how is this digital ecosystem going to make my life easier, right? Be honest about the trade-offs, I would say, that they're going to have to make. Again, it really goes into transparency. A lot of things are going to be easier for them. Some things are going to get harder. And you need to be as honest with the things that are going to get harder than what is going to become easier, and really focus on tangible value. As I mentioned, again, it's really about show the numbers, show real value. Don't just say, oh, it's going to be amazing, you're going to be able to do this. It's like, you're going to be able to reduce the time you spend on a patient by 10% while increasing the quality of the support that you can give. And I think the last element I would say of change management, not internal, mostly external, was also about clients. And this is where we had the hybrid approach come in as well. Is that because we told them, because everybody was scared, was like, what do we do in low to middle income countries if the patients can get the digital solution, if the infrastructure is not ready? Then what do we do? And that's why we say, look, we'll push it where we can, but if there are any challenges, we still have the approach that we've been using in now. And this hybrid approach has been working extremely well all the way up until today. And now we have 95% of our clients which are pushing for digitalization.
So, yes, I mean, in your industry, yes, you might have a lot of challenges, because you need to navigate different compliance framework, different countries, manage this change in your companies. You created a new department, the digital department, and also you changed the company. So how did you build the right team and get the organization to adopt this new way of working and also this new way of some way thinking?
That's an interesting question because, well, first of all, I hope I have the right team. I know my team is extremely good. So no, I'm kidding. We definitely have the right team for the job, and they're quite amazing, actually. But I'm not sure you can build a right team for change management. You could hire someone that's purely focused on change management, right? But I also think that change management is about the culture in the team. And this is a really big emphasis that we've been pushing ever since the beginning of Axios Plus and our digital journey, I would say, is that whoever came in the business obviously had to be competent in their field of expertise, right? You have someone that's focused on IT. We have a great team of developers. We have project managers, but one of the key things, and it's not just about training, it's embedded in our in our day-to-day operations, is communication skills with whoever you're interacting with. So for us, it's mostly for our project management teams because they are the one who get the requirements for new features, right? So it's about going to the people requesting these new features, understanding not the symptom, because a lot of time they come to us with symptoms, understanding the root cause and pushing, I would say, the best practice that I've outlined just before, which is about make sure that in the way that you run these meetings, emphasize on the fact that we are working with them, not for them. This is also why when we have a new feature, we have design prototypes that we share with the team prior to it going in development. When it comes back from development, we have extensive testing for our teams. Sometimes, and something we've been starting to do more and more, we even review technical documentations with some of the teams so that they understand how we operate. They understand what goes into a specs document that will later be turned into a feature. So again, I think it's not just about building the right team. It's about training the right team and fostering this collaborative, I would say, element within the team. And frankly, it's yielded really good results because we have great relationships across the company. When we push something, everybody understand why we push it, right? And they also see the role that they've played in it, right? So we all own it. Not all features are perfect. Sometimes you're going to miss stuff. But then because everybody is so involved, it's not a blame game, but it's more about, okay, we missed this. Let's what do we need? And let's push it together. So again, I think for me, it's about fostering this culture of being focused on change management, being focused on understanding the needs of your audience, and being
in healthcare. Trust is earned not just by what we build, but by how safely we operate. So how do you ensure that every digital decision, every feature is designed with patient safety and system integrity at its heart?
That's a very vital question, actually, given the industry we operate in. Well, I mean, look, as we mentioned, we build our own system, right? We operate in an extremely highly regulated industry, right? Again, we're all across the world. We serve vulnerable populations, right? And we have a lot of clients which are big pharmaceutical companies, right? They love to audit our system every 3 months, right? So in this environment, like the ethical, I would say, and operational stakes are incredibly high with, as I mentioned, just constant regulatory scrutiny, right? And operating in all these different healthcare systems where they all have different regulations means that we need to absolutely embed compliance into innovation. So in everything that we do, safety and compliance is absolutely foundational, right? It's not an afterthought. So, for example, we have a highly auditable system. You can track obviously the actions of every single user. We have a lot of control mechanisms in place to make sure that all our teams and all users of the platform upload all the amounts, all the documents that are required. Have an extremely, I would say, so complex but simple to use, which is quite important. And the pharmacovigilance system where our teams can report adverse events. And it's by design, right? We like to call it pharmacovigilance by design, right? But it's really about, again, traceability and compliance feature, right? incident reporting, audit trails. So for us, it has always been a key part of the design of all our solutions, right? And it's a strength because it focuses on patient safety and just focuses on overall compliance. But it's also a challenge because when you want to bring in new technologies, then this is where it becomes a bit more complicated as well, because something that might be easy to implement in any other industry becomes extremely hard in digital because in healthcare, because there are risks associated to it, right? I would say as well a key feature. I'm going to go actually a bit outside of digital for this, but one of the ways we address it is we make sure that we have robust SOPs that really balance between control, I would say, right, operability. Because at the end of the day, especially given we build a system in house, this system does reflect our best practices and our SOPs. So in healthcare, the first layer of any innovation or any, if you're in the digital space or in digital health, has to be patient safety, has to be compliance. And going back to your first question, that's a key part of how you build trust as well, right? Because patients know they are in safe hands. Patients know their data are safe. They can see that our teams are proactively reaching out to them because we have processes that are embedded in our digital systems. So yes, so for us, at least that's really how we ensure that every digital decision, every digital system is built with, I would say, patient safety in mind.
Jean-Noël, after all of those investments, reorganization, and rollouts, so how do you measure success today?
Another good question. Actually, do you know what? Before I get to actual KPIs, I would say, in ways that we measure success, right? I do want to touch back on trust for a second, because digital, I believe, has made trust measurable, right? And what this has allowed us to do, and this is also a part of how we measure success, right? But I think when it comes to clients, we've built that trust, and I think we've earned a strategic seat at the table as a strategic advisor, as a trusted advisor, and as a long-term partner rather than just as a service provider. And for us, I think that this is a key factor when it comes to success, because we have earned this position with our clients across the world. So now if you focus, I would say, a bit, if we look operationally, right? I'll split it in internal and external. So externally, the way we measure success, the fundamental way we measure success and the impact of our digital solutions is how fast can a patient go from being referred to one of our programs to actually getting their medication. And we've actually reduced that time by 52% in most cases. So when it takes 6 weeks for a patient to get their first medication, it now takes 3, right? And this was really, I would say, a major milestone while reflecting on real patient impact when it comes to digital solutions. But also, if we look at stakeholder-specific solutions, for example, we have a mobile application that allows physicians to refer patients to our programs, right? We've seen that a process that would take 45 minutes previously now takes 5, because everything is digital. So there's no documents to sign. Everything is signed online. The pharmacist dispense medication. It used to take 30 minutes. It now takes 5 as well, right? So it's, for us, it goes back to the patient experience being affected by the experience of all the stakeholders involved in the patient journey, right? Really, really plays a role. And this is also where we have tangible data-driven impacts, right? But also, our digital ecosystem is not just internal. We've also developed this whole patient management system, which was actually where the digitalization started for Axios. And then we built all these apps around it. So for us, it meant that, there was just better operational efficiency so that our teams could manage a lot more patients for each person. It meant faster onboarding for new staff. Something as well that is becoming incredibly important now is improved data integrity. We're really focusing now at Axios about leveraging data, becoming a real data-driven organization where, we really make data-driven decisions. And data integrity is absolutely paramount. And this is where having the system that has been designed with usability in mind, but also with a good amount of control measures, allows us to actually have that data to be then able to and to be able to leverage it. So that's internally. And this is also where, as I mentioned, because of this, we've kind of moved, I would say, from anecdotal observations, right, in regards to measuring digital impact, to actually move towards evidence-based, data-driven decisions, which kind of drive, I would say, the future decisions when it comes to our data infrastructure and just to our overall digital solutions.
Okay, great. So if you had to start over, what would you do differently or exactly the same?
I'll probably ask for twice the budget.
We always need money. We always need more budget, definitely.
Oh, but this is the thing, right? And to go back to the question of the buy-in, the thing about tech, right? There is a real linear relationship, I would say, between the amount you invest and what you get out of it, right? If we were to go back in 2017, what I know now, I would have doubled down back then. But so more seriously, I would say invest early in core infrastructure. So it's really about laying the groundwork for sustainable scaling and future growth. This is definitely what I'd do the same. As well, what we did then is that we did a very, very, not only thorough market study, but we also did a very thorough process engineering exercise of the company. Because the last thing you want to do is to automate a bad process, right? And I'm going back to something one of my mentors told me back in London, which was, especially when you work in digital and in tech, right? There's all these exciting new toys, there's all these exciting new technologies, but it's really about fix the boring bits first to then be able to implement these kind of technologies. And that's exactly what we did. And I would do it again. I would advise everybody to do this. If you want to implement a transformative digital solutions, you need to make sure that your processes are efficient as possible, because otherwise then they become extremely hard to change. And this is where you see a lot of inefficiencies creating themselves. The second one, which I think I would do exactly the same, is prioritize patient-centric design. Involve your patients, involve your users at the very beginning. And this is what leads to better adoption, right? And just more relevant and just more tailored solutions, right? So again, what I do the same, invest early, look at your infrastructure, bring your stakeholders in. The rest, we would still do the same, but it's every single decision that you're going to have to make to implement a digital solution or a digital ecosystem is going to stem from one of these three elements. Now, what I'll do differently, so we're very happy that we have a lot of features and solutions that work very well today. But I think we've also had some underperforming features, underperforming solutions. And I think the one thing I'd do differently is I would probably retire them a bit faster, right? And maybe some of them, I think, overstay their welcome. Some features just linger too long. And I think maybe having a more proactive review, maybe have, I would say, more periodic user interviews for specific features that we're not sure about. If we had this kind of real world, I would say, insight, right, in regards to the use of these features, then we would have retired a bit early, I would say. And that's really the one thing I would do differently. Other than that, I think everything really sorted itself out. It's actually not bad for what I'll do differently list. Right? I would say the key lessons of this whole exercise and this whole journey, nearly 10-year journey, by the way. We started in 2017, so we're not too far off. And digital transformation, right, is really about, it's 50% systems, 50% people. So change management, right? And I think, and actually, this is from my experience, having worked in London, having worked in Kampala, having worked with a lot of different systems, I think change management and the people aspect of things in digital is often underestimated, right? But it's really what ultimately, this is what drives adoption and success, right? And the second key lesson, and this is something I'll probably add to the list, I would do exactly the same, is balancing short-term wins with long-term vision is absolutely critical, right? It's a constant dilemma because, long-term decisions and long-term thinking really builds resilience that we rely on today. But sometimes it's so much easier to just do a quick fix on an underperforming feature or on, something that's not working as intended, right? But keeping this short-term vision, keeping this long-term vision is, I think, a key factor of success, because this is what builds scalability. This is how you get a really foundational system. And what you will realize is that short-term decisions with short-term gains often really hinder, I would say, the scalability of any system.
Jean-Noël, thank you very much for showing us what it means to lead through complexity, especially in your very highly regulated industry. And also you demonstrate how we can build a digital ecosystem without losing sight of the human need. So for that, thank you very much.
Thank you for having me, Stefan. Always very interesting.